that, we will get started. My name is Amelia, and I lead social and community at Evvy. I am so thrilled to be here with my colleague, Peta Navarro, who is the Chief Science Officer at Evvy, and the incredible Dr. Lynn Westphal, who currently serves as the Chief Medical Officer at Kindbody. If you will both humor me, I'm going to just give brief introductions to who you are, and then we can get into a little bit about who you feel you are and what you're doing at the moment. So Peta is a molecular biologist by training. She has spent her entire career working in biotech to translate scientific discoveries into technologies that empower people to live healthier lives. She, before joining Evvy, was a founding team member at Apellis, where she led the development of AI-based devices to monitor key biomarkers of inflammation for chronically ill patients. And we're so lucky to have her on the Evvy team, leading everything science that we do. And then, of course, we have the incredible Dr. Lynn Westphal, who's really a pioneer in the fertility and IVF space. She's double board certified in obstetrics and gynecology, reproductive endocrinology, and infertility. She joined Stanford, the Stanford University faculty in 1998, where she was professor in the Department of Gynecology and Obstetrics, director of the Fertility Preservation Program, director of the Third Party Reproduction Program, and director of the REI Fellowship. From 2005 to 2012, she was also the director of women's health at Stanford. And in 2012, she co-founded the Stanford Center for Health Research on Women and Sex Differences in Medicine, which is incredible. There are many more things that I could go on about, all the incredible work that you've done. But like I said, we're just so lucky to have you both here to talk about the relationship between the vaginal microbiome, fertility, and infertility treatments in general. So with that, I would love to hear just a little bit about you and what you're doing now, Dr. Westphal, and then we'll move over to you, Peta.
Thank you for having me. So I guess well, you've already given like a very lovely introduction. Currently, as the Chief Medical Officer at Kindbody, I'm overseeing currently 32 clinics around the country and helping with building up the clinics and overseeing the medical care. And we're very interested in improving access to care. So companies like yours that are able to provide care and improve access, I think are really aligned with our mission of trying to improve care.
Sorry, and Peta, can you tell us a little bit about what you're doing?
Yes, of course. I am very grateful to be able to lead everything, all of our efforts on the science side at Evvy. So really how we innovate on the sequencing and how we build the most robust R&D platform to then translate the science that we are uncovering into the care we provide to our customers, as well as the education we provide. I'm very happy to be here with Dr. Westphal.
And I feel so lucky as a women's health tech consumer to have you both on the side of women's health tech. Your brains are very much needed, and we're all so grateful for the incredible work that you're doing. So before we start talking about fertility and infertility, IVF treatments, I want to give a brief introduction to the vaginal microbiome, because I know not everyone here may be familiar with what the vaginal microbiome is and what it does. Evvy is a vaginal microbiome testing company. We use metagenomics to sequence the vaginal microbiome, and we're a very science-forward, research-based company. And there's a lot of emerging research that shows that there can be a relationship between the vaginal microbiome and fertility and assisted reproductive technology outcomes. So Peta, before we dive in, can you give us an overview of the fundamentals of the vaginal microbiome, sort of what it is, what happens when there's dysbiosis, and the health associations that exist there?
Yes, of course. Feel free to ask any questions along the way, but I always like to describe, if you think of the vagina and its role in the female body, it's essentially the structural connection between the outside world, which is full of pathogens and microbes, and on the other side of the vagina, our most important reproductive organs. And then if you think about a microbiome, in concept, it's a community of bacteria and fungi and other microbes that live on the surfaces of our body. So we have one in our gut, we have one in our mouth, we have one in our skin, and it turns out that we also have one in the vagina. And these microbes play a really important and protective role for us in a way that I like to refer to the vaginal microbiome as our local immune system. This means that the vaginal microbiome is really a critical determinant of reproductive health. When you have an optimal vaginal microbiome, it's usually dominated by protective bacteria, the most common, which are lactobacilli. And these microbes are functioning as a local immune system by producing lactic acid, keeping the vaginal environment acidic, and making it really difficult for any pathogens to replicate or survive in the vagina and cause havoc upstream. So even if pathogens get into the vagina, if you are dominated by lactobacilli, they can't really make it upstream because they can't survive in such an acidic environment. But if you have sex with a new partner, if your hormones start to fluctuate, if you have a long period, I'm sure a lot of us have experienced, your vaginal pH can rise, and some of these bad microbes can actually start taking over the protective bacteria. And that's when women and people with vaginas start to experience common infections such as BV, yeast infections, and UTIs. But it turns out this local immune system that we have is responsible for so much more than the vaginal symptoms we experience. The breakdown is also associated with broader health outcomes like IVF failure, preterm birth, STI acquisition, cervical cancer progression, and so much more. But today we'll be focusing on the IVF part.
It's so incredible. I'm 29 years old. I've had a vagina my whole life, and only recently did I know that my vagina could do these incredible things and all the superpowers it had, and this amazing ecosystem that had good bacteria and disruptive bacteria, and it was how important it was for me to nurture that protective bacteria for my overall health. And obviously, I think, as people start to think about having children, they think a little bit more about their vaginal health. And that's why a lot of us are here. So Peta, can you explain some of the research around the vaginal microbiome and fertility and assisted reproductive technology?
Yeah. Very excitingly, I think the scientific community is very close at identifying the vaginal microbiome as a very important biomarker associated with fertility. The consensus is that overall lactobacilli dominance is beneficial for fertility. And this seems to be true for just about any population. So those that are normal, the healthy population, those that have experienced recurrent implantation failure or a miscarriage, or those that have been diagnosed with unexplained infertility. And there's also some exciting evidence that suggests that modification of the microbes in your vagina actually improves fertility outcomes. So given what I just explained about your local immune system and lactobacilli and the protective microbes, the main goal is to really get patients who are interested in getting pregnant to a lactobacilli dominant state. And research has shown that if that happens, pregnancy rates do go up. So interestingly, a lot of the studies are done on women who are going through assisted reproductive technologies, but there has also been some research that shows, when you're thinking about conception for the first time and you go to the doctor and they start explaining, a healthy lifestyle can go a long way at improving rates of conception. Your doctor could recommend things like stopping to smoke, reducing alcohol consumption, eating a healthy diet, reducing stress as much as possible. All of that actually also is associated to a healthier vaginal microbiome or a vaginal microbiome in an optimal state. And so that is also a time that, you can start thinking about your vaginal microbiome. And then very interestingly, a lot of the research that has been done on the vaginal microbiome and IVF or ART technologies is that there's a lot of variables that go into fertility overall. I'll caveat with that. Also, a few things to keep in mind about the studies that I'm about to mention are most studies are small and done on very specific populations. And the fertility journey is definitely complicated, but very interesting study, a recent meta-analysis that looked at 17 different studies. I think it included about 3,500 patients, but it found that vaginal dysbiosis in IVF couples was associated with both early pregnancy loss, as well as a reduction in clinical pregnancy rates. So that again points to those that had less lactobacilli had lower rates of clinical pregnancies. And then additionally, the protective microbe lactobacilli seems to also be beneficial to increase success. So if someone is able to really move towards a lactobacilli dominant vaginal microbiome, their success rates for IVF could go up. One study found that lactobacilli's dominant vaginal microbiomes were associated with success, while those that lacked lactobacilli were associated with lower rates of success. And I'm happy to dive into any more details, but would love to get Dr. Westphal involved as well.
Yeah, Dr. Westphal, do you have any comments?
I think, Peta, you put that beautifully. Fertility is very complex, but it does seem like having, a healthy vaginal environment, and, it makes sense that should have some contribution to good fertility outcomes. But clearly this is an area where we need a lot more research, and, but this preliminary data I think is, very intriguing.
Yeah, I would say that the consensus is that lactobacilli dominance is beneficial, while dysbiosis is associated with infertility, but there is still a lot to uncover in the area.
Certainly, and it will be so exciting to see this research build and to be a part of this. And we always say at Evvy, treat people like they're smart, and we really believe in giving people access to information. And so we will be sure to share any updates with our community. And I'm sure Kindbody shares the same principles. And I want to talk a little bit more about fertility treatments. Dr. Westphal, you have been such a pioneer in so many ways in the fertility world, and I know we're all incredibly grateful for that. Can you tell our audience a little bit what got you interested in the fertility space as an OBGYN? I know there's lots of different tracks and paths that you can take within that specialty. And can you tell us a little bit about how you've specialized your work and research in fertility in recent years?
When I initially went to medical school, OBGYN was the last thing that I was thinking about doing. That was not on my radar as a specialty that I wanted to do. But I rotated through different specialties and nothing quite fit. And then I did OBGYN, and I rotated as part of that on the infertility service. And that was in the early days of in vitro fertilization. So, I kind of saw it building from the ground up. And it was, such interesting science, and to be able to help people build families was so rewarding. And then after I did that rotation, I decided that's what I wanted to do in my career. I did my residency in OBGYN and then did a fellowship in reproductive endocrinology. And it's amazing how the field has just, changed from when I first started. So initially, IVF, the first IVF baby was born 45 years ago, the end of July. And so, some people think it's been around like forever, and some people are like, oh, that seems, like a really short time. But probably over 10 million babies have been born in the last 45 years. Early on in the US, every baby born knew what number baby they were in the US. So I've had patients who have come and said, oh, I was baby number 100 in the US. Obviously now there's so many that no one has any idea what number they were. But early on, the success rates were not that high. And, if we did a couple of IVF cycles in a week, that was a lot. So the field definitely has changed tremendously. And initially IVF was for women who had tubal disease and tended to be women who were younger, who couldn't get pregnant because, right, they had had an infection or for some reason didn't have normal fallopian tubes. And then over time, the people who can benefit from IVF has increased dramatically. So there was a procedure developed in the early 1990s for men with very low sperm counts. So one of the other indications for IVF was if the sperm count was a little bit low, then IVF could help with that. But for men who had very, very low sperm counts, IVF still wasn't able to benefit them, or men who, sometimes didn't have any sperm in their ejaculate and they would need to do testicular biopsies. IVF, conventional IVF wasn't successful for that. So in the early 1990s, there was a procedure developed called intracytoplasmic sperm injection, or ICSI. And this is where one sperm was inserted directly into the egg. And initially, everyone was shocked that it worked as well as it did, because it seems, with conventional IVF, you're putting thousands of sperm around the egg and letting kind of more natural fertilization take place. With ICSI, you're doing this procedure that seems fairly rough when you're putting in a sperm directly into the egg. And it would seem that by bypassing kind of the normal fertilization that, that you wouldn't be able to get normal fertilization, but it actually works really, really well. And now in many centers, the majority of fertilization is done with that technique. So that opened up IVF to this other big population for, men who had severe sperm issues. And then around that same time, people started doing biopsies of embryos and started to be able to test them for chromosomal abnormalities and for diseases. So, for example, if a couple carried a mutation for cystic fibrosis, if they both carried it, they'd have a 25% chance of having an affected child. So with this preimplantation genetic testing, we could test the embryos and then not transfer embryos that were affected. Another type of testing related to that is looking at chromosomal abnormalities. So as women get older, as the embryos divide, they're more likely to make mistakes. And so the chance of having a child with some chromosomal problems, something like Down syndrome, increases as women get older. By the time women are 40, we know that well over half of the eggs are chromosomally abnormal. So that's why miscarriage rates go up, and the chance of having a child with a chromosomal problem increases. So by doing this testing, we can increase the pregnancy rate and lower the miscarriage rates, especially in older women. Then the other kind of the next thing that I was involved with, and this is very, very close to my heart. So soon after I started at Stanford in 1998, there was a young woman who was in her early 20s and had been diagnosed with cancer and was going to need to have a bone marrow transplant. And at that point, we told patients that if they wanted to preserve their fertility, that they would need to get a sperm donor if they didn't have a partner and freeze embryos. And this patient did not have a partner, and she really did not want to fertilize her eggs. She wanted to keep the option open of being able to fertilize with a partner in the future. So back at that point, it was very, very experimental, but we were doing research at Stanford. And so we put together a research protocol, and she was our first patient to go through. So based on her experience, we set up a program for cancer patients. We're able to get donated medications because often it's, especially back then, it wasn't covered. And then over time, as people around the world got more data on the safety of doing egg freezing and the success rates improve, now egg freezing is pretty standard of care. So that right there, thousands and thousands of women freezing their eggs every year. So that's been wonderful to see the benefit for the cancer patients, but also for any woman who may want to have some extra options in the future for fertility.
It's so incredible, all of that work that you've done. And I think one, it just speaks to, well, one, thank you on behalf of all of us. And two, how exciting it is that, 45 years is not a long period of time in the span of the history of the world or even the history of medicine. And I think it's so exciting to see how fertility treatments have evolved, how you've been able to help so many different types of people in different types of situations through this technology. Working at a vaginal microbiome company, it really makes us understand the impact that these sorts of new technologies and emerging fields of research can have on people's lives. I can imagine being 20 years old, getting a cancer diagnosis and feeling really afraid and not wanting to make a lifelong decision like that. And you really helped that person through that and set the standard for so many others. I have a quick question about population. I know that you mentioned, and I think IVF still is very expensive, but how do you think that IVF has evolved, especially in terms of population, from the time you started as a clinician to what you're working on now at Kindbody?
IVF, well, from the very early days, has become much easier to do and more controlled. So in the very early days, patients actually were admitted and were in the hospital, and they were testing their urine. And as soon as it looked like they were having an LH surge, they'd go in and do the retrieval. And early on, usually that was done by a laparoscopy. And when I first rotated on the IVF service at Stanford, we were still doing the egg retrievals laparoscopically. So that's a much bigger procedure and a bigger recovery, because you typically need general anesthesia and you're having, a more significant abdominal procedure. Then the vaginal egg retrievals started to be used, and that made the procedure, I think, much easier and made it more accessible in more locations. And that also, because it was easier, I think also helped with people who are maybe going to be donating eggs. So it was, easier for someone to go through a vaginal egg retrieval rather than a laparoscopic procedure. So those things, and then there have been medications that have made it a little bit easier to control cycles. And we have also found, partly because of all the data from kind of our cancer patients. So we found, like with our cancer patients, right, they often didn't have time and we needed to just stimulate them, whenever they could. And so we found that we could stimulate patients in different parts of the cycle and still have good outcomes. So the protocols that we've used, we can do stimulations in a much shorter period of time than in the past, because often we would wait for people to start their cycle, or we would give them medication that took a while to get control over the cycle so that we could start the stimulation. So the medications have made it a little bit easier and more accessible. In terms of the cost, early on, there wasn't much coverage. There are states now where it is mandated that there is coverage. So there are some states that actually have pretty generous coverage. There are a number of states where there are bills or people who are trying to get bills so that it is covered. And we've seen more access, especially for like the cancer patients. So there have been a number of states that have passed mandates that fertility preservation needs to be covered for cancer patients. Also, there are a lot of companies who have decided to add fertility benefits because it does make them more competitive. I know living in Silicon Valley, years ago, Facebook initially added egg freezing for their employees. And then, of course, the other tech companies in the area decided to be competitive that they needed to add it. And then at Kindbody, we really have worked to make it cost effective for employers. And last year, we actually were able to get Walmart to give a fertility benefit to all of their employees around the country. So that's a huge number of patients who have had access because of these employer benefits.
Such a huge win for fertility health and women's health, and it just speaks volumes to working with your employer. When one big company changes, others will follow. Good lesson. So
yeah, hopefully more and more.
Hopefully more and more. We got to keep pressuring them.
Yeah.
Dr. Westphal, I know we actually have a lot of audience questions that have come in, so I'm going to ask you one more question from the script that we have, but then I want to get to some of the people in the audience. So do you have any thoughts on how research on the vaginal microbiome and fertility will change the way we approach, or you as a clinician approach, assisted reproductive technology?
There are a lot of patients who fall into this unexplained infertility category, or patients who will have an embryo transfer, everything looks perfect, and we don't have an explanation. And it may be that a subset of these patients, it may be related to, some change in their microbiome. Obviously, the microbiome's, kind of hard to study because there are different ways of looking at it, and it changes as mentioned earlier, right? There are hormonal, dietary, sexual activity. I mean, there are ethnic differences. So there are a lot of things that will impact the microbiome. But I think in some of these patients where we don't have an explanation, this may be another thing to look at. Then after that, so there's kind of the diagnostic piece of it. And then after that, we need research on, so if we do find something that we may think correlates with decreased fertility, is there, a reliable way to kind of correct that, to give them a healthier microbiome? So I think that's a really important area of research going forward. Are there, ways, people have tried different methods, oral, vaginal things to improve the microbiome, but I don't think currently we have like a standard recommendation and know what's best for that.
Peta, do you want to share anything, based on what the research you've done in building Evvy care and or clinical care with Evvy, and how you've seen sort of that transition from disruptive to protective?
Yeah, I mean, just going back to the unexplained infertility point that Dr. Westphal made, I think it's an incredibly frustrating and daunting thing to hear, right? Like, we actually have no idea why you're not fertile. And it feels like we get put into this black box, and, you want to hope that people are investigating. And I think our goal at Evvy is really, how can we change the definition of infertility, or at least, drop it from 30% of people being diagnosed with unexplained infertility to maybe 20% or 15%, and have that 15% be able to conceive or become pregnant through our understanding of the vaginal microbiome. But I think, a lot of the research kind of points to lactobacilli dominant is great, positive fertility outcomes. Dysbiosis is associated to not as optimal fertility outcomes. I think what we're still trying to understand is how to transition very specific different populations from dysbiosis into lactobacilli dominant, there's things like sex is a big trigger for vaginal infections. We need to have sex in order to conceive. So how can we build resilient vaginal microbiome communities? We also have a lot of hormonal fluctuations that affect the vaginal microbiome. And so really understanding not only what bacteria are there and what are they doing, but understanding the mechanism of action, and right, like how can we improve the immune system of your vaginal microbiome, even though you have to have sex, even though you're going to experience hormonal fluctuations. And so really understanding from a microbial level, from an immune role, what is going on, so that we can understand how to switch regardless of your age, or how to transition into a protective microbiome regardless of your age, regardless of your race, your ethnicity, regardless of your sexual practices. And so it's really understanding, what are the levers that we can pull, and how can we personalize that with our understanding of the vaginal microbiome. But I think, historically, a lot of the research of the vaginal microbiome and fertility has been done using a type of sequencing called 16S. And 16S, it's great. It's definitely better than PCR. It gives us a picture of your microbiome, but it doesn't get to strain level specificity. And it's really bad at detecting a lot of different species, right, of bacteria, because you're only sequencing one variable region. And so I think what hopefully we'll be able to uncover so much more by using metagenomics and whole genome sequencing, and really start understanding, are there specific strains of bacteria that, could lead to more beneficial outcomes, or can we actually start uncovering much more specific biomarkers using metagenomics? And so I think that is what we're incredibly excited to do. And I think with Evvy Care, we're going to start understanding, who is responding to care, who is not responding so well. What can we do in the research for the non-responders? Can we start double tapping and looking into specific strains? Can we look into their lifestyle? Like, I think, we're constantly evolving the care we provide by everything that we are seeing. And so I think I'm incredibly excited into what Evvy's research can power, and how we can advance our understanding of the microbiome's role in fertility by using a better type of sequencing.
Thank you so much. Okay, I want to move into some audience questions. There are so many good questions, and I think that just speaks to how hungry people are for information and knowledge. So thank you both again for taking your time today to speak to everyone. Dr. Westphal, I think this is a good one for you to answer. I know there is no one size fits all, and I'll do more testing when the time comes. My question is a general guidance. What is the absolute deadline to get pregnant, considering overall good health and healthy lifestyle? I'm 36. Is IVF safe after this age?
That's a great question. So fertility is very complicated, right? Because every month it's a different egg, a different sperm, different uterine environment, right? Microbiome's changing. So there's no way to tell in advance how quickly someone's going to get pregnant. So sometimes people look like everything is perfect and they should get pregnant really quickly, and then they don't, and then they fall into this unexplained category. And then there are people who I thought should never get pregnant, and they get pregnant easily. So that's kind of the frustrating thing about fertility, is there's just no way to predict, or even people can get pregnant easily and have pregnancy complications or have miscarriages. Many pregnancy complications, we're not always able to predict in advance. The safest thing is always to try to get pregnant at whatever age you're, the soonest it crosses your mind, because we just never know. And right, you can have two people at the same age who may have very different fertility, and we can't always tell that now. So there's some general tests that we can do just to make sure there isn't something that will actually prevent pregnancy. In terms of safety of doing IVF, for most women, as long as they're healthy, especially 36, pregnancy rates tend to be very good with IVF. So most women at 36 are good candidates. Sometimes there are people, though, who do seem to have early aging of the ovaries, and so at 36 their ovaries may be more like 46, but overall most 36-year-olds should have good success with IVF. But as I said before, as women get older, especially as women get closer to 40, we start to see that the majority eggs are chromosomally abnormal, and then as women get further into their 40s, pregnancy rates really do drop off. So I do recommend, just to try at the youngest age that you're ready, because you just never know how quickly your fertility may change.
And Dr. Westphal, I more so as a patient than my scientist self, but I think one misconception that I had when I was looking or thinking about egg freezing or fertility, one misconception was, will it affect my future fertility if I freeze eggs right now? And I understood that it won't affect any future fertility, and also learned that what really matters is the age of the egg, right? So that's why egg freezing is so beneficial, to where you can freeze your eggs and then do IVF at a much older age, just because the uterus does not age as fast as an ovary. And so I feel like there's so many misconceptions. And I think one other thing I'll call out, again, as a patient, not a clinician or scientist, is that I think, as women, how everything we experience in women's health, whether it's your period or what birth control, it's mostly about whisper networks, right? It's about, oh, what works for my sister, what worked for my friend, what worked for my aunt, my grandmother. And I think it's tricky when a lot of patients say like, oh, well, my sister got pregnant when she was 42, so I should be fine. And then, you get to 42 and you have a hard time. And so I feel like there is so much involved in fertility. And then I think genetics plays a role, but I feel like it's more of just a concept we want to think about, and it doesn't really play that much of a role. But just wanted to get my journey recently thinking about this and all the misconceptions that I started uncovering.
Yeah, I think it's a really important point. A lot of people think, oh, if I freeze eggs, I'll go into menopause sooner. And that should not, that's not the case at all. So women who are freezing eggs should think of it as that we're just rescuing the eggs. So every month women are losing hundreds of eggs. Even when women are pregnant on birth control pills, they're losing hundreds of eggs every month. As you get closer to 40, probably losing 1,000 eggs a month. What we do with an egg freezing process is we just kind of we save some of those eggs that would otherwise just be lost that month. So doing egg freezing does not make someone go into menopause any sooner. We're not going into the reserve of the ovaries. And we do see people, so let's say you're 36 and think that you want to have, a few children, and you haven't started trying yet. So some people want to freeze eggs in advance and then try to get pregnant and then keep those frozen eggs, or if they've made embryos, keep those maybe for their second or third child. Let's say they're 40, 42 and, having difficulty, then they can use those frozen eggs later on. So the odds of getting pregnant are related to the age of the egg at the time it's frozen. The health of the pregnancy. So pregnancy complications are related to the age at the time someone is pregnant. So most women, still have healthy pregnancies, as they get into their 40s. And, even I've had patients who've had, very uncomplicated pregnancies, even in their early 50s. But we do know that pregnancy complications do start to go up as women age, just, because everything changes in the body. So the chance of diabetes and high blood pressure and things like that slowly increase as women get older.
There was so much information. I also had, as a patient, didn't know about the egg rescuing. I thought they were just going in and taking the eggs, but it's amazing. I think it's so important what Kindbody's doing, what Evvy is doing, just getting that information out there. We can't rely on whisper networks for the rest of our life, and we deserve to know information. I want to ask one more question, and then I want to be sensitive to everyone's time. Peta, is there an equivalent of the vaginal microbiome for men? I think especially in heterosexual couples, so much of the burden of IVF already falls on women, even when there is a male factor, sometimes in infertility, and freezing sperm at a younger age would be much easier and cheaper. Do you want to speak a little bit about the penile microbiome?
Yeah, there is definitely an equivalent of the vaginal microbiome in male fertility. I think most of the research on it calls it the semen microbiome. And there is definitely a role that it plays. I think from what I've read is the semen microbiome was rich and diverse in both fertile and infertile men, to where I think we see much more of a correlation of diversity and one bacteria dominated in women. And I think that plays more of a role in its immune function, right? To where the semen microbiome don't really need to keep like a healthy immune barrier, so to say. But so far there is no correlation with microbiome composition and male infertility, but there is definitely a male component to infertility. And I think a lot of times as women, we feel as if it's a personal biological failure. And we as companies can do also a much better job at speaking. As much as we talk about infertility for the female side, I think there's a lot of education to be done on how to also talk to your partners about the male infertility.
And I think the same thing goes for, recurrent vaginal infections. Now the CDC recognizes that bacterial vaginosis there's evidence bacterial vaginosis can be transmitted sexually. And there's a lot of research that's happening now on partner treatments and trying to evolve that language. But so many people in our community, I know, have felt the burden of feeling like they carry the infection, obviously the physical symptoms, but then the shame and the stigma that comes around it and the stress that it can play on your relationship. And so we're really here to support you, similar to the male-female infertility kind of separation, and saying, you're not at fault for having a vaginal infection. So just wanted to throw that out there. Well, I know that we have only a minute left. There are so many questions. I'm just floored with how wonderful everyone has been. Thank you so much for tuning in. Peta and Dr. Westphal, I learned just a great deal in this 45 minutes. So I hope one day we can do this again. This was so fascinating and interesting. And Dr. Westphal, again, thank you for everything that you've contributed to this field, and Peta to the vaginal microbiome. And I'm just so excited that women's health is evolving as it is, because it means so much for us and it means so much for all of our children.
Thank you for having us and organizing it. I want to just tap into one more. I'm just going through the audience questions right now and just want to answer really quickly the first one, which is, what is the timing of the effects of the vaginal microbiome on IVF success rates? And I just wanted to clarify that most of the studies have looked into the vaginal microbiome composition right before transfer, about 1 day or 8 days before transfer. So just that is, to our understanding, that is the time where it matters. But thank you, Amelia, and thank you everyone for listening. And
thank you so much. We'll be in touch via email with the recording, and I hope everyone has a wonderful rest of their day. Thank you so much.